Welcome back. Time right now is 9:46, I think is what it said. All right, hoping that's correct. A new study has showed that skin cancer is on the rise here in the U.S. and especially, get this one, during the winter and spring. So here to tell us more about how we can protect our skin, we've got dermatologist Dr. Melanie Palm from the Art of Skin in Solana Beach. Good morning.
Good morning to you, Ginger.
This is so important. Every Californian needs to know about this.
Yes.
We're talking about skin cancer, but you know, typically you think, oh, that's something I have to worry about in the summer because we're outside. You're saying not so?
No, we can still get about 80% of the sun rays during a cloudy day. So all this crazy weather we're having where we look at the forecast, not so happy about the rain, we're still getting UV exposure. And today we understand it's not just UV, but it's also visible light and infrared light. But we want to talk about skin cancer today.
Well, and something else that I thought was really compelling about some of the information that you sent in is melanomas. You would think, okay, face, arms, exposed areas, but that's not where you're finding them.
I know. You know, I've been really shocked in my clinic, and I do general and cosmetic dermatology. I'm a solo practitioner. We've had 6 melanomas in 6 weeks.
Oh my goodness.
There's about 100,000 cases per year, and it's on the rise, and it affects uncommonly young patients, although the average age is in their 60s. My youngest patient was in her 30s just recently, and the eldest was in her mid-70s. But it's true, it doesn't have to be just in sun-exposed areas. 80% of melanomas are related to sun exposure, but there's a full 20% that happens where the sun doesn't shine. The scalp, the genitalia, between the toes, the soles of the feet, especially in African-American patients or patients that have skin of color. Areas that we call acral, palms and soles, can be affected disproportionately.
Interesting, because that's not necessarily the areas that you would be checking.
Yes, absolutely.
Very interesting. What about day drinking and its relationship to skin cancer?
I know, I'm going to cramp everybody's San Diego day drinking
style. But that's okay, you're beautiful, so this is a soft blow coming right now.
It is. There's a new study that showed white wine and also day drinking actually increased chances of skin cancer. So maybe rosé is a compromise, I don't know. But if you tend to drink a lot of alcohol, it decreases antioxidant levels. But I also think it's behavioral. So if you're outside, you're having a good time, you're not thinking about protecting your skin and probably more likely to get a sunburn.
So it doesn't matter what time of the year, you need that sun protection.
Yes. Especially here in San Diego, and especially if you're fair skinned, but even I have had African-American patients that have had skin cancers, including melanoma. So really important, just because you may think that you've got a little tan going on, which isn't a good thing, or you've got some inherent pigment to your skin, all of us are at risk of getting skin cancer.
Okay, let's talk about good moles and bad moles.
Yes.
Let's start showing some of these examples and talk to us about what they are.
So these are some of my own patients. This is actually a melanoma, and you can see it's very dark in color. It's sort of like the ugly duckling. So if you see something that does not look like the rest of your moles, it's something that you want to look out for. See your board-certified dermatologist. Get it biopsied to see what the diagnosis is.
Okay, next one.
This is a precancer spot. This is called an actinic keratosis, and it's a precursor to squamous cell carcinomas. And we'll talk about ways to proactively treat these rather than just reactively getting it freeze treated in the dermatologist's office.
Okay, so another red flag. Slide 3. Oh, yeah.
So this looks really scary, and this actually ended up just being a severely atypical mole. So I'll tell you, when I biopsied this, I was very concerned that this was an evolving melanoma. But this is what we call a dysplastic nevus, or a very abnormal mole that's on the continuum of developing into melanoma.
Okay, the last one.
So this is something I want to talk about. This is a procedure before and after for precancer spots in the chest called photodynamic therapy. We use it on the face, the forearms, the scalp. That's actually where it's FDA approved. But I use it on other areas to proactively get after those precancerous spots. The second photo we saw of the pink spots that are precursor to squamous cell carcinomas. I love it because I'd rather be proactive than reactive.
Great information. I think this conversation is just starting, something that we need to follow up on as for sure. Really appreciate the content. Really appreciate you showing us some things to look out for. Dr. Palm, thank you.
Thank you so much for your time.
All right, we've got more coming your way after the break. Don't go anywhere.